The Mesa Chamber of Commerce Inside Business Podcast brings you a unique view of Mesa through its vibrant business community and the subjects that are important. The podcast is produced in the Mesa Chamber of Commerce Media Studio, sponsored by the University of Phoenix. Our podcast is hosted by Mesa Chamber of Commerce CEO Sally Harrison. Please enjoy this episode of the Mesa Chamber Inside Business Podcast.
Hi, this is Sally Harrison with the Mesa Chamber of Commerce, and today I have the pleasure of having my friend Dr. Kristen Bishop with Keystone Natural Family Practice in the podcast studio with me to answer all things about naturopath.
Perfect.
It sounds like stuff you know.
Super excited to be here.
Well,
Thank you for having me.
I'm really glad you are. So tell me, what is naturopathic medicine?
So in my opinion, naturopathic medicine is sort of the blending of both worlds in a really, really good way. So we get most of the Western medicine as well as Eastern medicine. We're trained more in nutrition. We get homeopathy. We can do IV therapy. We can do all kinds of things that conventional medicine doesn't always offer. So it really is the best of both worlds.
So what made you choose naturopathic medicine?
So this would probably be a very long answer, but in short, I was raised really allopathically in Ohio and had a great family doctor that we loved. But then I had my third child at home, and once I did that, that was when my midwife kind of turned me on to this whole natural world that at first I thought was a little crazy, but obviously I grew to love it, and it made a lot of sense the more I kind of got into that world. And I had no idea naturopathic medicine even existed. Growing up in Ohio, we had no idea that that was a thing. So it was all new to me. And then I found the school here in Arizona and ended up moving out in 2007, July. Bad, terrible time to move here, but
hey, if you can do that, you can do anything.
That's right.
Yeah.
So we stayed. So here we are. I've been practicing for 13 years. So
13 years. And a lot's changed since you started.
Absolutely.
Yeah. Okay. So is the training different from other doctors, and is the scope different?
So training-wise, it's pretty similar. We all do 2 years of didactic, and then we do 2 years of clinicals.
All right. What's didactic?
Oh, classroom based.
Okay. Just saying, some of us out here might not know that.
Okay, good. Glad you stopped me on that one. So yeah, we get all of the biologies, all the anatomy classes. Those are pretty standard, whether you're an osteopathic doctor, a medical doctor, a naturopathic doctor, chiropractic doctor. Most of that's all the same. Our clinicals are where we really differ because we have to learn all of the additional homeopathy and acupuncture and nutrition and all of those extra things that naturopathic medicine brings in, where the medical doctors wouldn't get that type of training.
Okay. Well, how's the experience between naturopathic and conventional medicine different?
I would say the experience is that naturopathic doctors are trained to treat the whole person, so we don't specialize. I think one of the downfalls of the medical system is that we've almost over-specialized. It's really, really hard to take care of people, like only looking at their heart, for example, or only looking at their stomach, because it's all in one person. So we're trained to treat the whole person. Like I said, I grew up with a family practice doc who really took care of our whole family. He didn't spend time like looking at his computer trying to figure out who we were because he had taken care of my grandparents, their 8 children, and then the grandkids. So he kind of knew our family history. He just knew us as a family. And that's what I personally want to bring back, is that family medicine doctor. So I would say the experience is different because, well, people are looking for that again. They want that family doctor where they can take their kids, and if they get sick, it's not going to another doctor. Everybody can be seen by one. And people who just know you and you have that kind of relationship with their physician, because it's super important that you have that good relationship, and we've kind of lost that in the system.
We've lost it a lot. Yesterday I asked somebody, so who's your family doctor? And I got this blank look. It's like, well, I have a heart doctor. I'm like, oh, okay, but your heart doctor's not seeing you for like a stomach issue.
No.
Well, no, I would have to go find somebody for that. Well, wait.
Yeah.
Yeah. So heart doctor, somebody that did work with this person's feet. And I'm like, wow, so you have literally a different doctor for everything. It's like, well, yeah, kind of. Oh, okay.
Right. And it's not usually efficient. Usually they're
No.
going, and then you're sitting in a waiting room for an hour here only to be told, oh, well, everything looks good on my end. Go try this specialist. And then you're off to the next specialist,
Right.
and round
Yeah.
and round we go.
Yeah, who's got time for that?
Right.
So let's talk about the other non-fun part. Talk about direct primary care, or DPC.
So direct primary care is a business model of medicine that is kind of sweeping across the country right now. And basically the medical doctors, the osteopathic doctors, a lot of them are fed up with the medical system. So they're jumping out, and direct primary care is direct from the doctor to the patient. So we remove the pharmaceutical influence and remove the insurance industry from primary care. So I do think that you need insurance for hospitalization,
Sure.
chronic care, catastrophic, that type of thing. But we've found that we can do primary care so efficiently and so cost effective that it just makes sense to just take care of people in a primary care way. So the DPC model is just that. We remove the insurance and the pharmaceutical industry and just take care of people.
Wow, what a novel approach.
It really is kind of old school medicine.
It is.
It's just,
But as a patient of yours, I heard so many people through the last couple of years saying, I can't even find a doctor anymore because my doctor quit after COVID, or it got too expensive because of the insurance for a doctor to practice, things like that. And I'm thinking, wow, I just make a phone call and go in and see somebody, or they help me over the phone. And to think that you have to wait sometimes months
Right.
before you get in to see a doctor seems very counterproductive.
exactly. 100%.
That's just crazy.
And those doctors are probably becoming DPC doctors if they can, because if you just Google DPC, there's a whole movement around it. Like Trump did some executive orders to make sure that we had the laws protecting it and we weren't seen as an insurance industry. And so there's been a lot of movement in Congress even around the direct primary care. And it's truly a win-win. Like the doctor has better satisfaction and quality of life, and the patients really, really appreciate it.
That's great. So why is this model of primary care exploding across the country?
I think just that, like, it's probably more consumer driven than anything, because we hear all the time, like, people will say, well, I have my insurance, but I have a $10,000 deductible that we never meet because we hate the medical system. We don't want to go in and sit in the waiting room for over an hour to get in and have 5 to 8 minutes with our provider.
Yeah.
Nothing's ever really accomplished except maybe I'll get an antibiotic when I need
Get a
it.
prescription.
And we're just finding that a lot of times it's cheaper to pay cash. So as we teach people that, and I'll give you an example, like if you need an x-ray, we've seen with insurance, x-rays can cost about $150, and we've negotiated cash pay rates of like $27 for an x-ray.
Wow.
For MRIs, we've heard people say $1,500 to $3,000 with insurance, and our cash pay is $295. So that's what I mean by we can do medicine significantly more, like less cost. It's way more cost effective, less expensive than using the insurance when we don't really need the insurance.
Makes a lot of sense. So your family practice is called Keystone Natural Family Practice. How does Keystone implement naturopathic medicine and direct primary care? Because this is really, to me, it's
I should ask
so
you
smart.
the question.
No,
You
it's
should
just
take
so
it.
smart.
Okay, so most of the DPC clinics in Arizona, as far as I know, are more traditional, conventional medicine, and they're great. I have nothing, bad to say about them. I know a lot of the doctors who are doing that, but I think we're really the only true naturopathic clinic that does that. So what we do is it's a membership model, and you just pay a pretty low monthly fee for your membership, and then you have full access to the clinic. So you can come in every day if you need us. You can come in once a year, however you want to. But in addition to your membership, that covers like all of your visits, sick visits, well visits, whatever you'd need on that front. But you also could get acupuncture, and like for a member, it's $25 or something to get
very
acupuncture.
reasonable.
You can do cupping. We have the IVs, nutrient IVs. We have an infrared sauna. So all those additional services that we get to implement. Plus, we have a lot of people that say, I've been on a blood pressure med for 20 years. I don't even really know if I still need it. So we can safely take you off the blood pressure med, maybe start you on a botanical medicine to make sure your blood pressure stays down, make sure you're safe. So for people that either can't take certain medications, don't want to be on that many medications, there's lots of options for them. So it again is a nice bridge between the conventional and the naturopathic world. Like I have a guy who does international business, and so he might call me and he's like, I'm leaving for China in the morning and I have a sinus infection. So I can easily get him a Z-Pack. But after, the third or fourth time of this, then we have the conversation, let's think about what you're eating that may be causing these recurrent sinus infections. So we do more root cause medicine and really look at, again, the whole person, his lifestyle, how we can work with him to prevent so that he doesn't need a Z-Pack every, 6
every
weeks.
trip.
Yeah. So it's really fun like that. And I think I love what I do because those people get healthy. And like we just had a guy completely reverse his diabetes with no meds. He's lost 40 pounds. His A1C is back to normal. He's off all of his pain meds because his back no longer hurts. Imagine that. And he's sleeping better. Like his whole quality of life is better. And he came in last week and he said, my son is starting to ask, like, Dad, what are you doing? Like, I need to kind of figure this out. And people at work are saying, what are you doing? So by doing this, like, not only are we getting the patients healthy, but we're getting their families healthy, which in turns get their workplace healthy, which, we're making healthy communities because they're teaching each other, which is so awesome to me.
Very cool. So what can people expect to get when they go to Keystone?
So my goal is just that personalized care. So when you come in, I want it to feel different. You don't wait in our waiting room. You might wait, 5-6 minutes.
If
But
that.
yeah, if that. Sometimes I'm waiting for the patient, because so the time that you come in, you get a half hour with your doctor. It's not sitting in the waiting room.
30 whole minutes, people.
Yeah.
That's unheard of now.
But there's so much more that goes into health. Like sometimes we'll be talking and they're not doing well, and I get the luxury in that 30 minutes of saying what's going on in your life, and maybe their dog died, or maybe their husband lost their job, or you have no idea, and that all impacts people's mental, physical, spiritual health. And so to truly get people better, we need to have that time in that relationship. And then we're really big on saying, like, what are your goals? If your goals are weight loss, then that's going to be what we're going to put first. But sometimes weight loss doesn't happen because there's environmental toxicities. Maybe you grew up in an area with, on a golf course where you're getting pesticides and chemicals sprayed, and that's holding some of the weight on you. So we have to go down all those paths to kind of get to the true root of what's going on with people. And so that's what I love about it, is we really get to know our patients and can really make a difference.
You have a great team. And it's
Thanks.
nice when you walk in and you see people that have been there for a long time.
Yeah.
You have a really great team, and they just make you feel very comfortable.
Thanks.
Yeah.
Yeah. And we want that when you walk in. It's not like insurance card and driver's license, as they slide the window over. It's more like, hey, Sally, how are you today?
Well, and that's exactly it, because I know going in, they want you to fill out the same forms, not with you guys, but in general, you fill out the same types of forms. And it's like, I was just here 2 weeks ago for something, and you're asking me to fill the same paperwork out again. Okay, sure, I'll do it.
Yeah, exactly. Yeah.
Yeah.
So knowing, and the team will know you and things like that.
Yeah,
so
makes a huge difference. Okay, so how can people learn more about Keystone?
Probably our website would be the best. It's www.keystonemedicine.com. And all the information on the membership is there, and kind of what we do and who our providers are. So.
And you are located, I know you just opened another clinic. We don't need to necessarily talk about that one because it's not in Mesa, but your best clinic is in Mesa.
Yes, the OG clinic is in Mesa. Yes, it is our largest clinic. I opened it 13 years ago after I graduated.
Yes.
And now we have 2 additional clinics as well to better serve the Valley.
Yeah.
Because like I said, it's consumer driven, and people, I get calls, start in North Dakota, we need you in Wyoming, and I'm like, okay guys, give me a minute.
So the Mesa clinic is off of the 60 on Kristen.
Yes, Kristen and 60,
Yeah.
in the East Valley.
Okay.
Far East Valley.
And you do have clinics clinics in?
Phoenix and Chandler.
Okay, again, that's fine. That's great. No, I'm really happy for you because it just shows that people are finally understanding what the value is and that there is a need out there.
Absolutely.
Yeah.
And
All
thank
right.
you for all your support. You've been with me almost from day one, probably before day one.
I remember, well, yes,
I think I
I
was
knew
still
you
in school,
before,
yeah.
but yes, I do remember your grand opening. It was very fun.
Oh yeah,
Yeah.
When we had Matt Salmon.
Yes,
Yeah.
back in the day. Anyway, well, next time you have an update, let us know so we can have you back and talk some more.
Perfect. Thank
Okay.
you so much.
Thank you.
All right.
This has been a Mesa Chamber of Commerce Inside Business podcast. You can find all podcast episodes at iTunes, Spotify, or your own favorite podcast website. You can also find them online at mesachamber.org. Content of this podcast is copyright the Mesa Chamber of Commerce, unless otherwise noted.